Hi, my name is Dr. John Vizzuso. In 2015, I got my doctorate degree in business administration, and a wise professor told me, get your degree and change the world later. Well, I'm here to tell you, Human Assets is here to change the world. We're here to make a difference for you, your employees, through coaching, through education, through interventions. This organization is here to make a difference, engaging one person at a time. Disengagement is deadly in healthcare. Over 200,000 patients every year die due to medical errors. And when I teach this to the students, they'll say, Dr. Vizzuso, does that really happen? 4 months ago, where I live, a hospital put the wrong kidney in the wrong patient. It is absolutely deadly in healthcare. You know, when you look at the qualitative and quantitative data of employee engagement, when you have disengagement, low profitability, high turnover rate of employees, which is very costly, poor customer service, poor products and services. So organizations that have a high rate of disengagement are not healthy organizations. Emotional intelligence is very important. It's the ability to care. It's the ability to sit down with an individual and just listen. Listen without judgment. Listen to understand. Without emotional intelligence, there's very little way that you connect to an organization, to other people. Well, I think you first have to teach them to listen, and doing some exercises where they can only ask questions in a scenario. They can't give input, they can't give advice, they can only ask questions. And when there's silence, you teach them to live in the silence, not to add their voice. And I think that's the first part of teaching somebody to really care about someone else's feelings, is when they listen. Physician staffing today has been a challenge, and it's going to continue to be a challenge. You see high attrition rates, high turnover rates, high burnout. Physicians don't want to be physicians anymore. It's the only industry that you can be sued on what you do or what you don't do. It's the only industry that you don't get paid for what you charge. And so when people are coming out of college and thinking lawyer, doctor, business person, doctor is not the forefront anymore. And it's because of all these issues. Trends in physician staffing, and I think it's going to continue, is high shortages in specialties of radiology, cardiology, neurology, high demand for those specialties, high burnout, high attrition, high retention rates, and less people going into that profession from college. There are 4 parts to the Engage Me process. The first part is an assessment, assessing where your organization is culturally and from an engagement perspective. The second part is actually developing the Engage Me plan. What interventions are you going to do to help improve your culture and engagement? The third part is actually installing coaching on call, the group coaching circles, to affect that implementation. And lastly, it's maintenance, making sure that you're doing that going forward, and more assessments on your engagement. Once an organization goes through the Engage Me process, they're going to have a really deep centered understanding of where they're at. They're going to know engagement principles. They're going to know who's engaged and who's not. And those that aren't engaged are either going to change due to peer pressure to be engaged, or they're going to leave the organization, which allows the organization to hire new employees that are engaged and have psychological ownership day one, thus fixing their employee engagement issue. To reduce the emotional power index, you first have to do some training to the leaders to get them to understand that their place is in the organization, not behind a desk, and teach them how to round, teach them how to interact with the employees in their departments, and make that as part of their everyday chore, their everyday job. because once employees start seeing them in the departments where they work, it will start to lower the emotional power index. An employee that is disengaged, I think, first has to review what their expectations are. And if the organization can't meet those expectations, they need to either change their expectations or go find somewhere else to work to be happy.